All right, well, welcome everyone to our webinar. I'm Sanjay Gupta, co-founder and director of strategic operations at Emerald Health. We work with medical practices across the country to strengthen their revenue cycle performance and stabilize their cash flows. We've been doing this for the last coming up on 16 years now. I'm excited to have all of you join us for today's session. It's called Stop Chasing Payments, Revamp Your Revenue Cycle, and Reduce Days Sales Outstanding. I'm joined today by our main speaker, Mr. Senthil Whale, our Senior Billing Manager here at Emerald Health. Senthil brings over 18 years of hands-on experience in medical billing, AR recovery, and denial management, and he's led many real-world turnarounds. We'll be walking through some of them today. He'll be sharing live case studies on how we took two struggling practices from red to black by tightening workflows, reducing DSO, and eliminating revenue leaks. So we'll cover that towards the end of the presentation. Once again, thank you for taking the time today out of your busy day to be here. Our goal is to keep this interactive and practical, so please drop your questions in the chat as we go, and we'll make sure to address them during the Q&A towards the end of the session. What we have lined up today in terms of the agenda is as follows. First, we'll review the end-to-end revenue cycle, highlighting the critical processes that most often challenge practices. From there, we'll look at practical root cause analysis techniques and denial prevention strategies you can apply in your own practice. And finally, we'll wrap up with key automation considerations to help you scale collections without adding more staff. And as I mentioned, we'll review results of optimization for two of our customers that we onboarded in 2025 and walk you through the actual numbers as live case studies. And after the main presentation, we'll open it up to Q&A, and we'll go through the questions. Quick housekeeping before we begin. This session is being recorded, and it'll be available to all attendees within 24 hours. And in terms of the timing, we have 45 minutes scheduled for the content, and we'll leave about 15 minutes for Q&A. With that, I will hand it over to Senthil to introduce himself and then go through the slides. So thank you again for joining us. Go ahead, Senthil.
Thank you, Sanjay. Hi, everyone. How are you? I hope everyone is good. Today, we are going to discuss about the stop chasing payment and revenue and improving the revenue cycle process here. The first thing we are going to talk about how we can reduce the DSO here. Let me take to a situation many of us can relate to it. We had for example, a multi-specialty practice, a partner with a strong patient volume, experienced provider, and good clinical outcome. But every month the cash flow is less. Management or team leads might asking why the cash flow is less, even though we see more patient. The main question is, it's not a practice failure, it's an operational failure. Dispute inside, right? Revenue leakage happens in multiple ways. For example, revenue leakage happens in a silent way. For example, payment might delay, not denied entirely. Let's go one by one here. The first. See, the revenue cycle process can be picturized into three parts. First is front office, second is mid-cycle, and third is back-end here. See, most of the practices focus only on the end stage, back-end process here. But the actual problem starts on the front-end process. For example, when you schedule an appointment, right, we need to look into multiple categories actually. Let's take a business into 3 points. Maybe a front end, mid cycle, and back end actually. First, we need to focus on the front end. Front end is that where most of the things happens actually. For example, whenever we book eligibility verification, whenever we book an appointment means we need to verify a couple of key information. The first thing is verify eligibility. Also, we need to see whether the patient having a proper policy, proper insurance information, or a proper authorization in place. Once everything in place, then only we need to book an appointment for this patient here. Also, what we need to do, we need to gather the maximum information upfront, like what would be the patient actual copay, what would be the patient actual copay, and what is the patient the benefits here. Once we gather all this information upfront, right, that makes easier. We can cut down a lot of denials upfront here. So the front end work, the first stage of an RCM, it's an eligibility verification. The practices who are strong in this department, right, they can cut down a lot of denials upfront here. There are multiple ways we can do it. The next slide will also the authorization. When you do an eligibility verification or a front-end work, right? Front-end work can be divided into two parts. One is verifying the patient eligibility and benefit. Other thing is we need to check for authorization and referral here. Many practices fail to do this part. They don't. They initially they will check eligibility, but they don't pay attention on authorization part or a referral area. So here we need to pay attention to all the categories, even for prior authorization, also to the referral year. Many practices they pay less attention to this part here, especially authorization. Authorization, it's an important process. It's once you are required an authorization, we need to have a process step in place to get an authorization. Also the referral. We need a proper referral system in place to get the referral from the PCP office here. Also the next, it's a charge entry process. After we verified the eligibility, the provider will see the patient and we need to give a proper input to the process. We need to give a proper input to the providers. What are the coding we need to use? What are the CPT code we need to use? That input, it's really a mandatory one. We need to give a key information to the providers, like educating the practice, also educating the clinicians here. Once they have a proper information in place, right, they can enter the right information. Once they enter the right information, then it goes to the claims scrubbing part. See, most of the offers not have a proper tool in place for this claim scrubbing here. So we need to develop a tool to do the claim scrubbing. For example, adding a modifiers or adding any kind of a rule in place, like a payer. A certain payers require a certain codes here. Once you had all these scrubbing in place, right, that can reduce a lot of denials upfront. So whatever you do, right, you have to do it upfront actually. So that can improve the process in a clean way. The common errors there are incorrect CPT codes or incorrect ICD codes or missing modifiers or demographic incorrect, everything. So the best practice would be the first pass ratio would be 95%. Practices who are maintaining the 95% first pass rate, right? They have a good increase actually. They have a good increase in the DSO. The next one is the denial management. See, denial management, it's a big process actually, the big process. For example, instead of reacting to a situation, right, we need to work proactively. For example, first we need to identify the denials immediately. how soon we are identifying the denial, right? That makes a big difference in the process. If I identify the denial immediately means I can work towards a solution and I can save a lot of claims in the future. Also, understanding the denial is a key point here. For example, if I'm working in a nursing home, if I'm working in a nursing home practice, I cannot use an hospital codes here. So the root cause of the analysis makes the big difference in the denial here. So once you work towards the denial, also understanding the denial and addressing the root cause of the problem, that can improve the practice efficiency here. Also the rule, for example, a maximum number of practice, right? They lacks in denial, actually. They lack in knowledge in denial. They don't know how to work on the denials here. Denials can be categorized into three parts. The first one is the denials into a patient-related problems, and then claim-related problems. The third part is provider-related problems. For example, anything related to the patient, right? For example, insurance ID problem or a patient not having a proper benefit. All these things we can address in the front-end process itself. For example, I'll go back to the first slide. Here, the front-end side. We can address all these things in the front-end stage itself. In the mid-cycle, we can address the CPT code denials or denials that is related to the claim actually. And the last stage of the denials is a credentialing. Anything related to the provider credentialing, right? Like provider was not participating and provider was not having any benefit towards that certain plans, means we need to address in a different way. Also, each denials require a different approach here. For example, when a denial related to a patient means you need to open the complete account actually. You need to open the complete account, not addressing the particular claim here. Many practices fail to do this. See, they will react only to the claim, not to the entire issue here. See, you need to see it in a different way. For example, once the claim denied for a coverage issue means you need to open the complete account for this patient and see how many claims are lost in before or how many claims are we are having a future appointment. So we need to address all together. For example, I'll give you another example here. The second case, if the claims related to a diagnosis code issue, that will affect only the claim, one claim here. So we no need to open the previous claims here. The third scenario, if the claim denied for a credentialing means, that's a different approach. We need to open all the encounter for the provider, for the payer. For example, if the provider is not participating with the BCBS means, we need to open all the claims for the BCBS. It doesn't matter what the patient are. We need to open all the BCBS claim for the patient here, for the provider. So different approach require a different denials here. So people who are experienced in the denials, right, they can really bring big changes in the practice. See, for generally addressing the denial is different, but systematically addressing the denials makes a big difference in the process. Also, that can definitely increase revenue in the process. So for people, what they will do, they will address only the claim-related denials. They don't address the system here. We are addressing the system. I'll give you one more example. When the provider is non-participating means, how to do it means, first we will identify the payer. Let's take a BCBS as an example. If a provider John is not participating with the BCBS payer means, we need to create an alert in the appointment screen, front end actually. So when the front end people book an appointment for John means, they will get an alert. So the appointment not get booked for a BCBS under the John combination. So it's a continuous process. So it's a combination of a back end team and the front end team. Sometimes the knowledge is not being transferred properly from the denial team to a front office. Here, what we need to make sure whoever works for the practice having the complete knowledge about the practice. These are all key points here. Many practices fail to do this kind of a things. They do not have a proper workflow in place. They do not have a proper system in place. They will identify the issue, but not been root caused actually. So we need to identify the issues, also root cause the issues are, and we need to give a solution to it. And what are the measures we are taking not to repeat this problem? So this is really an important part actually. The denial management only shows how the practice are really effective in working towards a solution. Once we have all these measures, right, definitely practice can improve the collection here. Also, many practices, they don't rebuild the claim. They don't rebuild because they don't know how to rebuild the encounter. See, certain payers require a certain type of rebuilding here. Not only not only just rebuilding the encounter with a proper modifier. No, no, we should not do like that actually. There is a protocol for each and every payer. First, we need to identify those protocols. I'll give you two, three examples here. Let's take a federal payers and commercial payers. Federal payers require a different approach, and commercial payers require a different approach here. So when you identify the denial, you cannot simply rebuild it actually. Many practices, they will do it actually. They will simply rebuild the claim and they will get the same denial again. But they missed to mention that this is a correction of my old encounter. So I'm not sending any new claim here. I'm correcting my claim. So please make a payment for this correction here. We need to clearly communicate that information here upfront. We will educate the team. We will educate the entire team to do this. Also, many practices lacking in claim submission part actually. When the claims, how soon you are submitting the claim, that makes a big difference here. For example, if the provider is signing off the claim, means max to max within a 48 hours we need to submit the claim. But what they will do, many billing companies or practices, they lack on submitting the encounter. They still use a paper submission. But now most of the payers are receiving their claim electronically. We need to make a full use of the electronic claim submission here. And the next slide.
One thing I want to just add to what Senthil said, as far as the denials, right? If your denials are anywhere near 10%, that's a big red flag for your practice. Even 5 to 10% is not great in terms of denial rate, but most practices right now are experiencing 5 to 10% denials routinely. 10% and greater is definitely a big red flag. 5 to 10% is a yellow, I would say, for sure, especially if it's closer to the 10%. Really, a lot of the practices that we are working with, we are able to get the denial rate down to, we say performance benchmark is 3 to 5%. We have some practices, once we are optimized, they're running between 1 and 2% denials, net denials. So it can be achieved, but it takes due diligence and constant work, like Senthil said. So it's not like a one and done type of thing. The whole system has to be working, the front end, mid cycle, and back end for it to get to the 1 to 2%. But it is achievable for any practice.
Yes,
So I
yes.
just wanted to throw that in there. Thank you, Senthil.
Thanks, Sanjay. Also, Sanjay, one more thing I wanted to add here. Many practices, right, they don't work on the denial here. The data shows out of 100 claims getting denied, only 15 of them getting rebuilt here. 85% of times claims are not being worked. That means the clean claims makes a big difference here. So the practices who are submitting a clean claim, they are getting a payment. Also, they no need to work on the denials here. Once the claim get denied, most of the practices not have a knowledge or not have a system in place to work on the denials here. So 85% of the denied claims currently are going in a non-collectible. Providers are losing money completely. So how effectively we are have a system or a denial system in place, right? That can increase 5 to 10% of the practice revenue. Many practices, they are not aware about these things. What they will do, they will judge the practice collection itself 10% less. Actually, once we started working, once we deploy a proper denial management person to this practice, right? They can clearly bring that additional 10% revenue. It's not an additional 10% revenue. The revenue they are losing for many years, actually. The revenue that is lost by the practice for many years, we identify those 10% and bring back to the practice here. Also, one more thing here, on the same denial management, why the practice is not paying more attention means they don't know how to file an appeal. They don't know how to work on the appeal. They don't know how to work on the corrected claim. They don't know how to work on the appeal. Is a very big process here. So the denial management team should have a knowledge on how to file an appeal and what is the filing limit for each and appeal. So when you're filing an appeal, right, the appeal should have all the documents, actually, all the documents in place. So our appeal will turn into a result. All these things are really matters when you work on the denial management. Thank you, Sanjay. I'll go to the next slide. The next one, the two areas practice are losing money. The one is a denial. We know how we need to address the denials here. The second area is the patient collection here. Patient collection. See, most of the practice will get revenue 80% from the insurance and 20% from the patient here. 80 out of 80%, right? Practice is already losing money by 10 to 15% by having an incorrect follow-up, not having a proper denial management system here. Also, again, what they will do, they don't pay attention to the practice patient collection here. Here, practice will lose in another 20%. Just imagine the practice is losing 10% in the inefficient denial management. Again, the practice is losing 20% from the patient follow-up. When you tighten these two things, right, you can easily make a 30% more revenue. See, I'm not increasing the patient here. See, first slide, I'll tell you. The first slide, what we discussed, we are not increasing the patient. Most of the practices struggling, actually. Most of the practices are struggling because of the incorrect system. They are having a patient volume. They are having a proper patient volume. They are having a proper clinician. They have a proven clinician. Also, they are having a very good front-end staff. But the team who works for the building, right, due to the wrong system they are following, they are easily losing 30% of revenue. We are not doing anything. We are fine-tuning the system. Also, we are identifying the loopholes here. Best loophole is the patient collection. Patient collection is a growing process. After the COVID, a lot of insurances increase the patient responsibility. Patient need to pay a co-pay, then co-insurance, deductible, and so many things here. We need to identify those responsibility upfront. For example, when the patient comes for an appointment, right, clean communication is important here. If I'm a patient, means I need to get a clear message, how much I'm going to get a responsibility, what is my copay. That message needs to be passed down properly to the patient here. Once the patient gets that message, 70 to 80% of the time, patient will pay that amount. Only few 20% might have gives a reason here. But majority of the time, patient will pay the copay upfront. Also, many practices are lacking in reaching out the patient. They are not setting up a tool in place. For example, nowadays, patient needs more visibility. Patient needs a statement digitally. Patient wants to, if a patient wants to make a payment, right, they need to make a payment easily. We need to find a tools. We need to set up a tools for the practice so the patient can click 1 or 2 times and they can make a payment here. See, how soon you are communicating patient responsibility, right? That can increase the patient collection in a high percentage. I'll give you one more example here. For example, maybe we can introduce a estimated tool here. For example, if the practice is a specialty practice, Specialty practice means there is a tools in place. Many practices are not using those tools here. We can estimate the patient responsibility before the appointment itself. See, many practices are what they're doing here. They are sending the bills to the patient after we completing the appointment. Many patients are getting surprised why I'm getting a $200 bill, why I'm getting a $300 bill. Here, patient is not being communicated. Patient is not have a proper communication. Practice need to start using the estimated tools here. When the patient book for an appointment, they can input all the information. Before the appointment itself, we can tell the patient, we can inform the patient, this would be your responsibility. You have to pay $200 or $300. That clear communication makes a big difference in the practice actually. Patient also feel happy, so they can plan it properly. When you send them a bill all of a sudden to pay a $300 means they will get confused actually. Why I'm getting a bill even though the insurance? Because of the service what we took. That makes a big difference here. So when you fine tune the denials, also the patient follow up, right? That can increase the revenue for the practice in a big way. Many practices are lacking in this two department, especially when you have a proper workflow in place that can turn the practice into additionally 10 to 20% more income.
Yeah, one thing I wanted to add in there to that is, implementing good tools is really key, and we will talk about that later too. But now instead of just not sending statements or sending paper statements, there's tools to send email statements, text statements, as well as online bill pay. All of that, those things are available, and we've implemented those successfully for many practices. And those are things that will increase your patient collections. Besides, tightening the process is really taking advantage of some very good tools that are out there for available to any practice.
Yes, yes.
Thank you, Senthil. You can didn't mean to interrupt you there too much.
Oh, thanks.
Okay, that
These
I
are all
guess
valid
segues into the
points.
automation piece. Okay, thank you.
Okay. This is the really key point actually. Now AI boom is there. Many of them, even they need or doesn't matter. They are started want to implement automation for everything. It not makes actually. See, the reality is automation makes inefficient actually when you not have a proper workflow in place. Also, the other point is automation makes ineffective process if only have an inefficient faster actually. For example, when you not have a workflow in place, right? Automation can make more mistakes. The first thing what you need to do, you need to create a proper workflow. You need to create a proper workflow. For example, the practice who are dealing with the 10 appointments, right? We no need an automation here. We need a proper workflow. That's enough actually. The practice who deals with 200 appointments a day, their automation is required. Also, where we need to use an automation that makes a big difference. I don't want to automate all my process here. Automation on a standard process, for example, the eligibility verification. When the patient comes for an appointment, right? Here we can use an eligibility verification. Eligibility verification is an automated process. Authorization we can turn into an automated process here. These are the key areas we have to do an automation part here. Once we do this automated, right, that can reduce the errors, also to improve the efficiency of the practice, here. Also, many practices, right, uh, they will do a automation, but they fail to use it actually. I'll give you 2, 3 examples here. First thing, nowadays all the softwares having a RT eligibility verification, real-time eligibility verification, but no one is activating it. No one activating the batch eligibility. See, there are tools already in place for many years. Many years where the RTI is available, but no one is using the tool properly because lack of knowledge, the lack of system knowledge here. First we need to understand what are the features already in place. We need to use the maximum features. Then if your practice is not getting the result, then we can go for a new process, new automation process. But many practices fail to use the existing feature and they will look for a new feature here. The goal is here, first we need to start using the existing feature and see how the practice is getting improved. If 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 we really need an automation is, then we can go for an automation here. Also, now the AI plays really a key point here. For example, many insurances now are doing a audit on the claims actually. Many insurances like a BCBS, Humana or Aetna, they are doing an audit on the coding part. Whenever providers submit any claims or with the codes, right, using the AI tool, they are downcoding the code actually. They are downcoding the code and they are making a less payment. For example, if a provider is billing for a level 5, 99215 means the payers are reducing the code to 99214 using the AI validation and they are making a less payment. 70%, 70 to 80% of the practice are not aware about this because the claim is not getting denied. The claim is getting paid, but they are getting a less payment here. They are due to this automation, right? No one is paying attention to the pay. No one is paying attention to the posting here. See, the automation helps in one way. Also, automation helps reduce in another way. We are having a new problem here. Due to the automation, no one is paying attention to the payment posting here. So what we need to do when we do an automation, we need to develop a checkpoint to identify these kind of tools. Whenever the procedure is getting changed, payment is getting reduced, we need to catch these things automatically. Also, why AI tool is important means we need to start using the tool. Providers need to start using this tool more and more. Because nowadays, insurance are using these tools to find an errors in the audit here, errors in the claims, like whether we are using the right CPT code or the right diagnosis code. So once the providers are start using it right, that can improve the practice efficiency, also the medical records. The next important thing is the workflow system. First, we need to start using, first we need to develop a proper workflow. First, we need to have a proper workflow. For example, any process, any practices, if they're not having a proper workflow in place, right, they will lose money. They will lose money. First, we need to develop a proper end-to-end workflow here. How the appointment is getting booked. And once the appointment is getting booked means what is the next step? How I need to give a reminder to the patients. Once the reminder is in place means when the patient is going to come. Before patient visits, what are the things I have to do from my end? Once the patient visits to the clinic means what are the things I have to do? And next, what is the thing? Once the claim is getting signed, first we need to define a proper workflow here. Once the workflow in place, we can fine tune the workflow. Also, we can add a AI or a RPA tool in between actually. That can increase the efficiency of the process. That can increase the, or else if most of the time practices will fail actually. What they will do the claim submission first and they will do the eligibility next. They will do the payment posting first and they will do the RTI next actually. There is a no proper workflow in place. So doing a work in an order that can increase the efficiency of the practice. Also, see, first what we need to do whenever we are facing a problem with any kind of a practice, right? First thing we need to do, check the current workflow. What the workflow we are doing right now. Audit the current method. What are the work I'm doing? How I can improve my system. The current assessment of the work, right, that makes a big difference here. Once we identify the workflow, identify the gray areas. What are the gray areas I need to improve? For example, if the work is not done in an order, means we need to change the order of the process so that things will be improved. Also, identifying the bottleneck. Sometimes what will happen, the things need to be done in the fifth stage, right? Many practices do it in the first stage, actually. So working in a proper order makes a big difference in the result. So I don't want to do the eligibility verification after my claim submission. It doesn't make sense, actually. The claim is already went to the payer. After it's reached to the payer, why I need to check eligibility? So the eligibility verification should happen at the time of an appointment, not the time of a visit here. So many practice what they will do when the patient visits the clinic, right? They will do the eligibility verification. No, you should not do like that. When the patient's booked for an appointment, right? 3 days before or 1 week before, you need to check an eligibility verification. So why we wanted to do it? If the patient having an incorrect insurance information, if the patient having a wrong ID number or wrong date of birth, means we can communicate to the patient immediately and we can collect the information on time. So when the patient comes for an appointment, right? When the patient visit the clinic, it will be an easy flow. I don't want the patient to stand for the in collecting the insurance card here. See, that's why the workflow is important. Collecting all the information upfront makes a big difference here. Also, what are the areas? Sometimes what we'll do, I'll give you one more example here. When the practice, all they're doing all their work, but the provider is not signing off the claim, means that's a bottleneck here. See, the workflow is important. Provider need to sign off the claim within a 24 hours or 48 hours. If the provider is holding the claim, means we need to identify those gray area and we need to educate the provider. See, the claims need to be get signed in. So the claims, once the claims getting signed in, means we will turn the money. We will get the money in place. So identifying the bottleneck is really important. First, setting up the proper workflow and identifying the bottlenecks and implementing the automation. What are the areas we can implement automation? We don't want to implement automation for all the part here. It not makes any sense. Where are the areas is really makes a big difference. For example, if the claims can be submitted automatically, means we can automate that part actually. If the denials can be worked automatically, means we can introduce the part here. So the automation, it's really important. Also, the fourth point is training a staff. See, that's why it's really important. See, denial team have a knowledge on provider credentialing. The provider might not participate, but the same knowledge the front office team might not having it. So training a staff, it's really important. Everyone in the practice should have a same kind of a knowledge. That makes a big difference. So the errors will get reduced here. The person who books the appointment, the person who works for the patient collection, right, should have a same kind of a knowledge about the practice. Not the workflow knowledge, but the practice knowledge is important. What are the payers we take it? What are the payers practices participating? What are the payers providers is enrolled? All kind of a knowledge need to be communicated properly to the staffs here. So spending a 30 minutes or 40 minutes on a weekly basis on training your staff, right, that makes a big difference here. Also, the last point, the KPI. See, also one more thing, identifying the problem does not give us a solution. Identifying the problem, it shows the practice problem. So reacting to it, how soon you are taking an action to this problem, that makes a big difference here. Most of the practices, what they will do, they will read the number, they will read the KPI, they will read the denial percentage, but they don't take any action. If you're not taking an action, right, that KPI not makes any difference here. So reading that numbers and working towards improving that numbers makes a big difference here. The next, it's addressing actually the focus on prevention. The important thing about any practices, any successful practice, right? Any successful practice, prevention is important. Addressing the front end and mid-cycle error, that's a key point here. 60% of our errors comes in the front end. Another 20% of the errors comes in the mid-cycle. Only the remaining 20% of the errors comes in the end stage of the process. So if I fine tune the process, right, I can cut down nearly 80% of my denial by having a proper system in place, like a front end and mid cycle. That makes a big difference in the process here. Also, practice medical billing and RCM. It's not a one-time exercise. It's a continuous improvement. 1 month we might see a collection. Next month, if you're not having a proper system in place, we will lose the collection again. So it's an ongoing effort. We need to keep doing that effort continuously. Actually, then only we can see the result. Also, recently we cured two practices actually, two of our practices. We got a good result actually. We got a good result. The practices came to us. The practice came to us with a high denial percentage. Also, their ARs are really high. Also, they are having a credentialing issue. They are not having a proper workflow. The collections are very low. This is a very big thing actually. They came to us not for the billing here. They came to us to identify the solution. What are the solution we can give? What we did, we understand the workflow. We understand the workflow. We improve the work completely. We implement the new workflow for the practice, like how the practice should book an appointment and how the practice should sign up the encounter and what are the steps they have to do. We draft a clear workflow and implemented it actually. We implement. That's the first thing we have to do it. When you take many companies fail to have a workflow in place. We once we started hiring a practice, once with the practice signed us to it, we need to first implement the proper workflow here. Once the workflow in place, then we can address the issues one by one. After implementing the workflow, we identified a lot of bottlenecks in the practice. We identified a lot of issues. For example, I'll give you one simple example here. The practice is submitting the claims also getting processed, but the money is not getting deposited to the account. The simple reason is they are not updated the banking detail to the payer. So what we did, we updated the banking detail and recovered the money from 2022, 2023, and 2024. Almost 3 years of claims got paid. It's already paid, but the money got not deposited in the account because the practice is not updated the banking detail. See, they are not because they are getting a paid information, but the money is not depositing. There is no one is reconciling the information. We went in and we verified with the bank statement that the money is not getting deposited. We called the payer and we checked with them. They informed us the banking detail is not updated. So we updated the banking detail and we got money. We got the payment actually from 2022, 2023, and 2024. See, many practices don't pay attention here. The reconciliation is important. That's why the workflow. Once we have a proper workflow, right, the reconciliation plays an important role here. Also, by creating a proper workflow, we identified the denials and also we address the credentialing issues one by one.
Senthil, do you mind
Yes.
scrolling down? We can't see the results. If you could just, yeah, just,
Sure.
yeah, okay, yeah, there. And also we have about 13 minutes left on the webinar, so I know we want to leave just a few minutes at the end for the Q&A. Thank you.
Oh, sure thing. So here, due to this effective process method, right, almost 46,000 got recovered from the uncollectible. They tag it as an uncollectible. Practice tagged as an uncollectible. No one is paying attention, but we step in and we said, okay, we'll take a look into it. And we collected 46K from the 22, 23, 24. The practice was really surprised to see that amount actually. It's a simple thing, but they have missed to do it actually. But after that, what we did, we improved the process. We improved the process and we set the denials. Also, practice lacking in denial management. Practice really lacking in denial. They don't know how to work on the specialty denials here. See, the PCP denials, it's a different thing, and specialty denials is a different thing. Specialty denials required a prior authorization, also the referral. These two things is really important. That's why it's connected to the front end work. People who books an appointment, right, they should have a proper knowledge what service they are booking an appointment, and what are the things they have to collect upfront, and what are the things they have to prepare before the appointment, like a prior authorization, referral. Everything plays a key role here. The practice is really struggling to do those things. We stepped in and we guide them how to do the all these things. That's a workflow. We guided them what are the patients required a prior authorization, and what are the insurance required a prior referral. We drafted a clear workflow. So whenever patient books for an appointment with the BCBS means with the CPT code, certain service means we created a table in place. Using the table, practice can refer and they can start requesting for an authorization. These are all simple method, but we should have a knowledge to create a table. See, the information is already there, but information need to be coordinated in a proper order. That makes a big difference here. Also, when the providers started seeing collection, right, the providers will start seeing more patients here. See, that can gives a big boost to the providers. Most of the providers, what they will see, even though I'm seeing a lot of patients, I'm not getting money. But once the providers started seeing payments, right, practice will increase the appointment. That's what happened here. We started clean up old AR. We showed them a revenue, how much the practice can earn by using the same appointment. Immediately, doctors what they did? Okay, Sindhu, this is really a good catch. We will add more appointments here. Now we have a proper method. Now we know what are the things will collectible. So they are increase the appointment also. See, indirectly we are helping the practice to add more appointments. I'll give you one more examples here. This is a one more slide. This practice, this is a second practice. We recently we started billing for this practice. This practice had the same kind of a problem. Uh, they are not having a proper workflow. They are losing money continuously. Whatever they do, they are not getting a payment back from the payer. They change the system. See, many practices will do this. Whenever they're not getting a money, right, they will change the new system, new PMM or new EHR. It's not going to happen. And money will not come if you change the system. See, the work pattern need to be changed here. This practice also facing a lot of problems with the denials. They have a huge AR. They're having a huge AR also. They are not having a proper payer specific rules in place. So we stepped in. First, what we did, we created a proper workflow. Second, we cleaned up the old AR. We cleaned up the old AR and we reprocessed almost 300 claims actually, 300 claims. Also, we created a standard operating procedure for this practice, how to work on it actually. That improved the process in a really good way. Also, 52K has been recovered from the uncollectible. See, the money they tagged as an uncollectible, we collected almost 52K from the uncollectible here. Also, the monthly collection, right? The monthly collection increased from 35K to 55K. In certain months, we reached up to 74K. 74. Now the practice average collection has become 55K. 3 months before, the average collection, 6 months before, the average collection is 35K, but now it's a 55K. You can see the big difference here. We are not increased any appointment here. Here, due to the clean workflow, the collection we are collecting at 90%, 95%. Slowly we are increasing the percentage here. So we are not losing any money. All the appointments are turning into a results here. And the 90 plus days previously, before we took over the billing, right, it was a 40%, close to 38%. After we take over, it's only a 15% now. It's getting improved slowly.
Thank you,
That's
Senthil.
all. That's all from our end, Sanjay. Any question from anyone, please let me know.
Yeah, you can just put on the last slide if you don't mind.
Sure, Sanjay.
Yeah, essentially, thank you for a very informative presentation, Senthil. That this was great, like walking through all the front, mid, and end cycle, back end cycle, I should say, of revenue cycle, how important all those aspects are. Um, a few of the questions came in centered around, how long does this process take? And I think you answered some of that in the case study, like the second case study. But can you talk about like how much time does it take to see improved results typically?
Within a 90 days, Sanjay. Within a 90 days, once we step in, right? If first important factor is we need to define a proper workflow for this practice. Once we have a proper workflow in place, right, we can see the result from 60 days to 90 days. Because in general, most of the practices struggle to set up the workflow here.
Mm-hmm.
Once we have a workflow, within a 60 to 90 days, we can see the result in reality.
And what if they don't have a dedicated billing manager, and how important is, I guess, staffing, right, to success?
Yes, Sanjay, there is a ratio actually. Dedicated manager is important. Also, the person's knowledge makes a big difference here. See, if I'm assigning a dedicated person, doesn't guarantee it for a payment here.
Mm-hmm.
The person, whoever we assign, right, that person need to be a knowledgeable person who knows what they are doing here. So when you are assigning a billing manager, that person should be knowledgeable and know what the payer policy is. If you assign a proper person, that really makes a big difference to the practice.
Mm-hmm. Okay. Another question was, what specific tools do you typically use, right, to achieve these results?
Yes, it's depends on the practice specialty, Sanjay. It's not based on the one tool or two tools. There are multiple tools in place, multiple tools in place. Also each process, right, have a different tools actually. Denial, we have a different tool, and patient collection, we have a different tool, and AR, we having a different tools here. So based on the practice requirement, we will set up a tool for them.
Mm-hmm. Okay. And then I think another question was just what's the cost of implementing these changes?
It's, for example, if they signed up with Emerald means, we will analyze it actually, because most of the practices, what they will do, they will introduce the tool without knowing whether it's give a benefit or not actually. That's why the expert analysis is important. First, we will step in and we will validate whether the tool is really required or not for the practice. If the tool is required, then only we need to see the cost part here. See, many practices, right? They don't validate the tools here. First, we will validate it, then only we will decide on the cost center.
All right. Thank you, Senthil. I think those are all the questions we had that came in. And so once again, I want to thank you all for attending today's webinar. If you have any questions, one of the things I would just want to add to what Senthil said, like, so it's not necessarily a cookie cutter solution. I think the process works for the end-to-end process stays the same, right? For each practice. But each practice does have unique workflows, if you will, right? And what you should be doing is analyzing those workflows and optimizing those workflows. And it's not necessarily a one-time process because payers, a lot of things, external factors also influence that workflow, right? So payer rules change. So when something used to get paid previously, you might start seeing denials, right? Because something changed outside of your practice, right? Because so it's a constant process, right? You can optimize initially, but then you have to monitor the process carefully throughout, all the time on an ongoing basis to see if there's any uptick in denials, if there's any uptick in days, how many days it takes to get paid. And based on what you're seeing by monitoring those KPIs, you have to adjust things further, right? So it's an ongoing process, as we talked about earlier. And at the end of the day, great results are achievable, meaning revenue growth, profits, practice profitability is achievable, low denial rates are achievable, but it does take constant staying on top of things to achieve those results. So once again, thank you for attending the webinar today. Appreciate all of your time. We will be sending the webinar recording to all of you as well as the slide deck. And if there's anything that you have any further questions on the presentation, feel free to reach out to myself or Senthil. Thanks very much, everyone. Have a good rest of the day. Thank you, Senthil.
Thank you. Thank you.
Thank you
Have a
all.
good day.
Thank you all.